discussing with you in the types of letter a kind of scenario when we will be writing with diagnosis, right? We have a scenario when we have the diagnosis given. So we can simply write down, thank you for seeing Mr. Alex, whose sign, symptom, and investigation are suggested for AMI for further management. We can also write it down with diagnosis in this way. Let's say, thank you. Let's say, in this way, thank you
Sir,
for.
instead of
So let's say we can also write down, I am writing or I am referring Mr. Let's say Alex, whose features are suggestive of AMI. This is also right. Referral letter when we have the assessment or diagnosis given, right? So we can write in this way. I'm referring Mr. Alex, whose features are suggestive of AMI, or thank you for seeing Mr. Alex, whose signs, symptom, and investigation are suggestive of AMI, right? These are two introduction can be written over here in this way. Is it clear to you? The second types of referral when we don't have any diagnosis given, without a diagnosis, right? We can have the symptoms only. Let's see. So when we have only the symptoms given, if we have the symptoms given, let's say, if we can see there, if we don't have the symptom but the situation, we can also write it down in this way. From our medical knowledge, that thing is being suspected to have something, but as per the provided case notes, you're not supposed to write it down. The what we can say the diagnosis. So we can just write it down. In this case, let's say I'm writing to refer Mr. Paul, who presented. We can simply write down who presented as well with, let's say, 5 days history of crushing chest pain. Let's say, in case we can write for definitive diagnosis and further management. So we can write down the introduction of a letter when we don't have the diagnosis given. Let's say I will show you the case notes. So now in this case, we don't have any, you can say, definitive diagnosis being given. It was just the symptoms, and we have written the symptoms only. Okay, differential diagnosis. You only have the differential diagnosis. We may have like 2 to 3 diagnoses being given. For example, we can suspect the condition to be any cardiac condition, or let's say APO. We can have, let's say, conditions in differentials, depression, or let's say BPAD. So these are few conditions that we have to see. In case in this can also be in this format. Let's say inflammatory bowel disease. It could be Crohn's or ulcerative colitis. We have certain situations such as obstruction and diverticulitis or carcinoma, right? So these are few differential diagnosis we can have, or even we have maybe more than 5 to 6 DTs. So there are two choices to write it down. The differential diagnosis, the first choice is as you have written the letter with symptoms. So we can write it down. I'm writing to refer Mr. XYZ, let's say, who presented, yeah, who has, let's say, if, let's say, who has 3 weeks history of chest pain and worsening of asthma. So, I would appreciate, sorry, if you could provide definitive diagnosis, right? It can also be done in this way. Let's say I am writing another letter to refer or thank you for seeing Mr. Let's say John, whose signs, symptoms, and investigations, or who, according to my differential diagnosis, has AMI, or either his symptoms are due to APO. So I would appreciate your further assessment. Things that are not detailed, but all the things are here. So we can write it down. Thank you for seeing Mr. Let's say Paul, whose features are suggestive of AMI, comma, HAPO, and worsening of asthma. That's it. Types of letter now. A letter with diagnosis, letter without diagnosis with symptom, and we also have discussed about the differentials when we have the differential diagnosis, right? So, in case of referral letter, when we have the diagnosis being given, okay, or without diagnosis, we have the symptom, we can write down symptom. And differentials, we discussed one of the way how to write down disease. But secondly, in case of differentials, we can also see, we can write down the symptoms directly. Like if you can see, I'm writing to refer Mr. XYZ, who has crushing chest pain, let's say dyspnea, and let's say you can just write down the main symptom for definitive diagnosis. So we can write it down just the symptoms as well in the introduction, right? In the introduction, in the urgent referral letter, the only difference is that either you can just write it down or add the word urgently, okay, or in here. So next type of letter is the letter of discharge. In a letter of discharge, the concept wise is kind of referral bag, right? It's kind of referral bag that we are writing this letter to we are GP, and we are writing this letter to the specialist, kind of referral back. So in case of referral back letter, first of all, when sorry, when the specialist is writing this letter back to the GP, so GP already know most of the information, like the past history. So still you have to read it and make your mind that which information is not relevant or not. This is the one point. Okay. The second thing is in letter of discharge, as you can see in a conventional letter of discharge, let's say we can write down in the introduction regarding your patient. Let's say I'm writing regarding your patient who underwent a successful right knee replacement, right? Or he would require your follow up. You are required your follow up, right? So we can see, we can write it down in this way. I'm writing regarding your patient who underwent a successful right knee replacement and he would therefore require your follow up, right? So in this case, we can write it down the introduction in this way, right? I'm writing regarding your patient who underwent a successful right knee replacement. He would therefore require your follow up. Okay. So we can see that the letter of discharge can be written in this way. We can also write it down, let's say, any other letter of discharge. Let's say I'm writing regarding your patient, okay, who has responded well, who has responded well to the treatment of, let's say, blah and blah for further follow up. Discuss. Now we are going to discuss
सर
about
एक सवाल पूछना
के बाद अगर हम बात करेंगे तो we can also see the transfer letter. And a transfer letter is from, you can say, lower setting to higher setting. लोअर से हायर में इसे ट्रांसफर लेटर लेट्स से अगर ये आपका फ्रॉम पेरिफेरी टू सिटीज ट्रांसफर है वेयर वी हैव द ट्रांसपोर्ट इन्वॉल्व, या लेट्स से फील्ड से हम इसको ट्रांसफर कर रहे हैं अबाउट द टू द सिटी सेंटर, तो ये आपका पेरिफेरी ट्रांसफर है, ठीक है ना। इसके साथ अगर हम बात करें तो वी हैव टू सी दैट आपका जो नेक्स्ट पार्ट है कि लेट्स से you know, like from ward to emergency transfer or from back to ER to ward, departmental transfers. Maybe we have the one-way transfer. If you can see there, if we are writing for one-way transfer, we have to see that, let's say, it could be GP to GP transfer. Let's say old GP is handing over the case to new GP. It could be specialist to specialist transfer due to any reason, right? So you can write it down. It could be, let's say, temporary transfer and so on. So we can simply write down, let's say, in transfer letter, I'm transferring Mr. XYZ if it's ambulance by ambulance who would require, let's say, on urgent basis. So we can write it down. I'm transferring Mr. XYZ by ambulance who would require ultrasound guided drainage of his liver abscess on urgent basis, right? So we have to see if we can write it down, this information, in this way. I'm transferring Mr. XYZ by ambulance who would require ultrasound guided drainage of his liver abscess on an urgent basis. It's a kind of transfer letter as well. We can also have an example when GP is writing to GP. So I can write it down. I am handing over Mr. let's say Blash, who is relocating to your area, right? I'm handing over Mr. XYZ who's relocating to your area. He, let's say, is currently having high blood sugar. For that, he was advised, blah blah. Therefore, you are requested to continue blah blah medicine after registration of this patient to your general practice, right? So we can write down. I'm handing over Mr. XYZ who's relocating to your area. He is currently having high blood sugar. For that he was advised blah blah medicine. Therefore, you are requested to we can say continue blah blah medicine after his registration into your general practice. So this was the GP to GP transfer. If we are transferring this patient as a specialist to specialist, maybe the patient underwent some surgery and is we can say he's recovering from the surgery. However, he has to relocate due to any reason. So we can write it down. This letter, let's say I am writing regarding Mr. XYZ who has been recovering post operatively to blah blah thing. However, due to his family and patient insistence, they need your ongoing care and further assessment, right? Due to a post-operative decision, like the surgeon was monitoring the patient, however, due to any reason, he has to move on to the next area with that. Okay. So afterward, we can see another type of letter of transfer when it's you can say temporary transfer any facility. So we can write down I am transferring this patient to the, let's say, nursing home for temporary basis. Let's say your patient due to her daughter traveling, he needs an accommodation space for the period of next 15 days, let's say. So we can write it down in the introduction for the temporary transfer. I'm transferring this patient to the nursing home for or to your nursing home. You can also write down for temporary basis due to her daughter's traveling. He needs an accommodation space for the period of next 15 days. He would therefore require. Anyhow, that will be the temporary transfer that we'll be writing. We can also have a letter of request. No, letter of request can be written to the allied professionals. We have letter to a nurse. We can write letter to the occupational therapist. We can write this letter to a social worker, and so on. So let's say if you're writing this letter to the, you can say, social worker, as the patient has right knee replacement surgery, but the patient developed depression, and now we are writing the social worker to help the patient resume normal life. So what we can write it down, it's a kind of discharge plus request letter. But we can write it down over here in this letter. So we can write it down. I'm writing this letter regarding Mr. XYZ, okay, who has developed depression during his post-op stay in hospital. I am writing this letter regarding Mr. XYZ, who had developed depression during his post-op stay in hospital. Therefore, he would require your social services. You can also write it down in this way. I'm writing to request your services. I request you regarding the provision of your social services as Mr. XYZ has developed depression during his post-op stay in the hospital. Right? So we can write it down in this way. The letter to the allied professionals. We are requesting for something. If you are writing this letter to a physiotherapist, let's say, so we can write it down. I'm writing to request, or we can also change. Let's say thank you for accepting Mr. XYZ who would require your home visit to provide him physio support, let's say, whatever the reason is, in order to improve his or her mobility. So you can see these are the